Biopsy is appropriate for chordoma when it's unclear whether or not the tumor is chordoma or not. Many times we will approach a tumor, a chordoma in the skull base, with the philosophy that we'll biopsy at the time of surgery. If it is clear that the tumor is chordoma, then we would go ahead and resect at that point. However, if it's unclear, it is often wise to wait for biopsy. The skull base is treated much differently than the spine, where a lot of times a biopsy has to be considered and done in a certain fashion to ensure there's not seeding. The risk of seeding along track of a biopsy, if it's done, for example, endonasally, is lower.
I personally feel that the biopsy should be done in every patient who has a suspected diagnosis of a chordoma. And there are several reasons for that. One is that the patient may be thought to have chordoma, but another diagnosis can emerge. I can tell you from my own experience that many patients have been referred to me with a presumed diagnosis of a chordoma, and imaging studies were highly suggestive of that. The patient's age was appropriate, the location was appropriate, and yet we do a biopsy and the tumor comes back as lymphoma, which requires an entirely different type of treatment. Not even surgery in some cases. Or the diagnosis comes back mixed papillary ependymoma that looks like a chordoma. And I have beautiful slides of that I typically use in our courses to emphasize the point that just based on the imaging alone, you cannot really make the diagnosis of a chordoma. For that reason, I feel very strongly that we should do a biopsy in every case. The other reason to do a biopsy is that this chordoma requires, at least in my view, in certain locations, very specific surgical procedure. And that procedure can lead to very significant functional loss for the patient. I cannot, consciously subject the patient to such a procedure unless I know 100% that that's the diagnosis and that's the type of surgical treatment that patient has to have. And so for all those reasons, I feel that the biopsy is absolutely a must in every patient with a suspected diagnosis of chordoma.